Hello guys, I hope you're well. I wanted to quickly talk about prednisolone. So when students are studying, they usually ask, why the hell would you give a corticosteroid in COPD? And we're going to try and understand why today. So prednisolone is an oral tablet, and even though it's not an inhaled corticosteroid like budesonide, prednisolone is given for COPD. However, it's given in an acute exacerbation of COPD when you have increased breathlessness which interferes with daily activities. Generally, the dose would be 30 milligrams once daily for 5 days. Now, the issue and problem that students have is prednisolone can be used in asthma. So it can be used in severe or life-threatening acute asthma. Why? Because it has anti-inflammatory activity, and obviously prednisolone is a hefty drug. It's used in GI issues and it's also used in respiratory problems. Now, it wouldn't be right to mention prednisolone if we don't mention its immunosuppressive action. So you would avoid live virus vaccines in those receiving immunosuppressive doses of corticosteroids. So contraindication of corticosteroids generally, and that's all corticosteroids, is you would avoid live virus vaccines when taking corticosteroids. So avoid live virus vaccines in those with an immunosuppressive dose. Now, when we when we think about corticosteroids, it will be wrong for me not to mention their side effects, right? So corticosteroids are plagued with a lot of problems, right? So, for example, caution is congestive heart failure, diabetes mellitus, glaucoma. This is just to mention a few. So when dealing with prednisolone, especially in the Gphc exam, understand that if they're asking for prednisolone, they could be asking you about the indications, what it's used for in respiratory, or it could be about UC, so ulcerative colitis, or it could simply be something to do with electrolyte imbalances, because what electrolyte imbalance can corticosteroids cause? And this is very, very important to talk about. So corticosteroids can cause hypokalemia. Also, they can cause osteoporosis as well. Weight increase, bone fractures, increased risk of osteoporosis risk. It can be problematic for chickenpox, for example. Any immunosuppressive condition, you have to be careful. It can also be an issue with psychiatric reactions. So systemic corticosteroid, particularly in high doses, are linked to psychiatric reactions such as suicidal thoughts and behavioral disturbances. So corticosteroids are associated with neuropsychiatric reactions, and that's a very, very important point to talk about. So they are a bit similar with montelukast, right? Montelukast can increase the risk of neuropsychiatric reactions and convulsions, etc., etc. Sorry, montelukast is about neuropsychiatric reactions. The seizures and convulsions is to do with not montelukast, it's to do with quinolones like ciprofloxacin, levofloxacin. And thank you so much, guys.